In America, some would say that not all healthcare is created equal. Our healthcare system is somewhat fractured by inequality, some suggest. The stats outlining health outcomes between the rich and the poor can be shocking. So where do we start to ensure the highest level of healthcare for all? I'm joined by the CEO of Adventist Health, Kerry Heinrich. Kerry, thank you for joining me.
Great to be here.
So I've known about Adventist Health for a long time. They're a wonderful organization. How would you describe your goals?
Well, Adventist Health, faith-based organization. We're focused on making a difference in the lives of people where they live, where they work. And it's gratifying to be able to be part of a company that is focused on making a difference in the health of people.
And I know one of your focuses is on the establishment of equity for healthcare. How are you doing that?
Going to the neighborhoods where people live, creating clinics, creating access. You know, data suggests that as much as 80% of your healthcare is affected by social determinants. And so we're focused in our delivery of care of where people live, how we can be relevant and accessible to them.
I recently spoke with boxing champion Oscar De La Hoya about how Adventist Health has impacted his family. Oscar, it's so great to see you. We've known each other in and out over the years, but
yes,
it's great. You're aging backwards. I don't know what's going on here.
No, you know, it's literally just being happy, good living. Life right now is just beautiful. So I'm very blessed.
So tell me about service with Adventist. How did this happen with you?
I was qualifying for the Olympics in 1992. I was turning 17 years of age, and my mom hit us with a bombshell news that she had cancer, and she only had literally a couple of months to live. Instantly, when they took her in, they had no idea who I was. If this was pre-Olympics, pre-Fame, whatever, but they treated us like family. The doctors, the nurses, right when we stepped into the door. It doesn't matter if you're a boxer, a fighter, an actor, this, that. No, they care for you. They really take care of you. So I'm really proud of that.
That was so interesting talking to Oscar De La Hoya, where he was talking about how daunting it was as a kid from East LA to walk into this big institution and to have people treat him, he said, as though he felt like family. And I thought that was one of the most significant compliments you could possibly get as an organization, particularly in healthcare.
It's so important to reach people and make them feel part of the system. Think about accessing a system you don't know anybody, and maybe you don't even speak the language, and being relevant in the community is what we're focused on.
But you put your finger on a conundrum that healthcare has been dealing with forever, and I don't think the average person knows this, which is physicians are willing to go in and dedicate some time, or nurses too, to underprivileged populations, people that are distressed. They don't stay. That's a problem. But you guys are taking care of that. You're working on that at least.
Well, we have residency programs, for instance, in Central California, focusing on recruiting residents that grew up in Central California. They train there, they go back to where they grew up, and they're part of the community. And that's how you make a difference, because they feel like they're part of the community and they can make a difference to where they grew up.
Well, I have to tell you, when I heard you were coming in, I am so grateful you're here, because I'm very aware of what you guys have been doing. I've been around an Adventist facility for many years, and if people are not aware of what you're doing, they should be.
We are committed to making a difference in every community where we serve.
So, if Kerry's enthusiasm is not infectious, I don't know what's wrong with you. You should be part of organizations like this if you can, or if you're inclined. Thank you, Kerry, for being here today. We appreciate it. As we said, for more information, go to the website. It is AdventistHealth, one word, .org. Be right back.